So I was actually reading about all those congenital dysplasia of the hip. That's developmental dysplasias of the hip. So I came across this, and this is what is known as the collapse of acetabular roof. Collapse of what? Acetabular roof. So for collapse of acetabular roof, it just refers to structural failure of the superior part of the hip socket. That's what the acetabulum. Understand? Okay. So, which is normally like the roof now should normally support and stabilize the femoral head. So when the roof collapses, the hip joint loses its stability, loses its strength. Are you getting the reason why we're studying this? So it leads to a lot of pain, leads to deformity, leads to impaired mobility. You're not able to use that joint like you used to use it. So the acetabular roof is the weight bearing what? Hip socket. When it collapses, it simply means the bone structure has lost its integrity, often due to a disease or trauma. So it results in a loss of support for the femoral head, causing joint instability and progressive what? Arthritis. Okay. So I have an image here showing the acetabular roof. So causes, what could make that roof collapse? It could be avascular necrosis, it could be trauma, it could be infections like osteomyelitis, septic arthritis, it could be metabolic bone disease like all those osteoporosis, rickets, and other conditions. It could be tumors. So clinical features is a lot of hip pain, the person is limping or have a lot of difficulties walking, you have restricted range of motion, progressive deformity of the hip joint. Okay. So complications, it could lead to secondary arthritis of the hip, could lead to limb shortening and gait abnormalities, could lead to severe disabilities. Most of the times when you leave this untreated. So treatment is depending on the cause of the issue though, you have to limit the weight bearing and all of that. So medications for underlying cause, advanced collapse, you do surgeries, all those osteotomy, bone graftings, then total hip arthroplasty, severe cases.